The temporal pulse. This artery comes of the external carotid artery and is found front of the tragus and above the zygomatic arc or cheekbone. This pulse point is assessed during the head-to-toe assessment of the head. And this is where you can find the temporal pulse. Next is the carotid pulse. This site is the most commonly used during CPR in non-adult as the pulse check site. It is a major artery that supplies the neck, face, and the brain. To find the carotid, tilt the head to the side and palpate below the jawline between the trachea and the sternomastoid muscle. Next is the apical. This site is assessed during the head-to-toe assessment before the administration of digoxin. Always count the pulse rate of the full 1 minute with your stethoscope at this location. The apical pole is the point of the maximal impulse and is found at the apex of the heart. It is located on the left side of the chest at the 5th intercostal midclavicular line. Next, the next is the brachial pulse. This is the major artery in the upper arm that divides into the radial and the ulnar artery. This site is used to measure blood pressure and as a pulse check site on an infant during CPR. To find this pulse point, extend the arm and have the palms facing upward. The pulse point is found near the top of the cubital fossa, which is a triangular area that is front of the elbow. Next is the radial. This is a major artery in the lower arm that comes of the brachial artery. It provides circulation to the arm and hand. It is the most commonly used as the site of count a heart rate in an adult. To find this pulse point, extend the arm out and have the palms facing upward. It is found below the numb in the wrist area along the radial bone. The popliteal pulse. This artery is found behind the knee and comes of the femoral artery. It is a rather deep artery like the femoral. To find the artery, the knee should be flexed. It is located near the middle of the popliteal fossa, which is a diamond-shaped pitted area behind the knee. Next is the posterior tibial. This pulse point, along with the dorsal pedis, is assessed during the head-to-toe assessment and is particularly important in the patients who have peripheral vascular disease. The posterior tibial pulse point is found on the inside of the ankle between the medial malleus and the Achilles tendon. Next is the dorsalis pedis. To find this artery, locate the extensor hallucis longus tendon by having the patient extended the big toe, then palpate down this tendon, and when you come to off it, go to the side and tendon, and you will find the pulse point.